Hi, I'm Amanda.
And I'm Erin.
We are going to teach you about how to measure active range of motion, specifically pronation and supination with a goniometer. A goniometer is a kinesthetic measurement instrument used to measure angles created at the human joints by the bones of the body.
An occupational therapist measures active range of motion, pronation, and supination of the forearm to assess the patient for the presence of abnormal movements, their willingness to move, coordination, muscle strength, and joint range of motion. By obtaining the patient's current active range of motion performance, the OT can interpret how their active range of motion impacts their functional abilities to complete desired occupations.
The purpose of this video is to assess active range of motion due to limitations in range of motion from disease, injury, pain, skin tightness, muscle tendon shortening, and prolonged immobilization. This is to eventually improve occupational performance and participation.
Before performing forearm active range of motion, it is important to know the precautions and contraindications of these movements.
Precautions include painful conditions, in the presence of an inflammatory process in a joint or other region of the joint, in patients taking medication for pain or muscle relaxants, because the patient may not be able to respond appropriately and movement may be performed too vigorously, in the presence of marked osteoporosis or in conditions where bone fragility is a factor, in assessing a hypermobile joint, in patients with hemophilia, in the region of a hematoma, especially at the elbow, hip, or knee, in assessing joints if bony ankylosis is suspected, after an injury where there has been a disruption of soft tissue, such as a tendon, muscle, or ligament, in the region of a recently healed fracture, and after prolonged immobilization of a part.
Indications include that active range of motion should not be done for 4 weeks following some tendon repairs or tendon transfers in the acute phase of tendon healing unless otherwise directed due to possibly causing further damage or interrupt the healing process immediately after injury or surgery. If the therapist suspects subluxation or dislocation or fracture, if myositis ossificans or ectopic ossification is suspected or present, active range of motion should not be undertaken without first ensuring the patient is assessed by a professional who has expertise in the management of these conditions.
Besides precautions and contraindications, safety concerns involve using a stable chair that does not have wheels or a plinth with locked brakes. Active range of motion testing should also be done in a clear space that is not overly crowded.
Pronation and supination are movements of the forearm. During pronation, the distal end of the radius rotates around the ulna from its position on the lateral side of the wrist to the medial side of the wrist. Two muscles in the forearm, the pronator teres and pronator quadratus, work together to achieve pronation by pulling on the radius bone of the forearm. The supinator muscle of the forearm and the biceps brachii of the upper arm supinate the forearm by pulling on the radius. These muscles rotate the radius in the opposite direction of the pronator muscles by moving the distal end of the radius back to its position on the lateral side of the wrist.
To begin testing active range of motion, pronation, and supination, the OT would first begin by completing the patient chart review, obtaining a goniometer, the patient chart, and a writing utensil, washing their hands, introducing themselves to the patient and asking how they are feeling, identifying any contraindications or precautions of the patient, educating and instructing the patient on active range of motion expectations and the process of using a goniometer, making sure the patient is seated in an upright position.
For supination, go to step 22. Tell the patient to bend their arm to a 90-degree angle, keeping their elbow tucked in. Tell the patient to keep their forearm in a neutral position. Use one hand to stabilize the elbow close to the individual's body and in 90 degrees of elbow flexion. For pronation, ask the patient to perform the movement to get an estimation of the patient's range of motion by saying, rotate your palm towards the floor. After observing, ask the patient to reposition their forearm in a neutral position. Palpate for the ulnar styloid process. Align the fulcrum of the goniometer proximal to the ulnar styloid process on the dorsal side. Align the stationary arm of the goniometer parallel to the anterior midline of the humerus. Align the movable arm to the dorsal side of the distal forearm. Instruct the patient to perform pronation while keeping their elbow at 90 degrees and against their torso. Move the movable arm of the goniometer against the dorsal side of the wrist, proximal and parallel to the ulnar and radial styloid processes. Read the measurement, record the measurement.
The normative data range for pronation is 75 to 85 degrees. The measurement we obtained was 85 degrees.
For supination, tell the patient to bend their arm to a 90-degree angle, keeping their elbow tucked in. Ask the patient to place their forearm in a neutral position. Use one hand to stabilize the elbow close to the individual's body and in 90 degrees of elbow flexion. Ask the patient to perform supination to get an estimation of their range of motion by saying, rotate your palm towards the ceiling. After observing, ask the patient to reposition their forearm in a neutral position. Palpate for the ulnar styloid process. Align the fulcrum of the goniometer proximal to the ulnar styloid process on the volar side of the forearm. Align the stationary arm parallel to the anterior midline of the humerus. Align the movable arm on the volar side of the wrist parallel to the anterior midline of the humerus. Instruct the patient to perform supination while keeping their elbow at 90 degrees and against their torso. Move the movable arm of the goniometer across the volar side of the forearm, proximal and parallel to the styloid processes of the radius and ulna. Read the measurement, record the measurement.
The normative data range for supination is 80 to 90 degrees. The measurement we obtained was 90 degrees.